I'm Bob Schrupp, physical therapist.
Hi, I'm Brad Heineck, physical therapist.
And together, we are the most famous physical therapists on the internet.
In our opinion, of course.
Plus, we are going to try to add a little humor to our videos, Brad.
And what do you mean by that, Bob?
Ha ha, you guys are funny.
Okay, Bob, what's the topic today?
The topic today, Brad, is very interesting. It's about patellofemoral syndrome. It's also called patellar femoral dysfunction. It's also called retropatellar. And it's also, all of these things can lead to chondromalacia.
Just another syndrome in the medical field where one simple thing can be called 5 different names and you cannot understand a single one of them.
But
so let's talk about what does it mean.
But to the lay person, it is called, what we are talking about here, Brad, is kneecap pain.
Get it? Kneecap?
We are so easily amused. Well, anyway, Brad, actually, kneecap pain is nothing to laugh about. It's very serious, can be very disabling. So we're going to go over the signs and symptoms of what kneecap pain is and see maybe if you have it. Brad, let's talk about some of the signs and symptoms that you might have with all of these syndromes, but basically kneecap pain.
Right.
You want to start or you want me to start?
Go ahead. We
right.
got a nice diagram here.
We've got an outline of where the kneecap is, and quite often the person who has these, patellofemoral syndrome or kneecap pain, they're going to have pain around the kneecap somewhere. It may be in both knees or one knee, depending on what you're doing athletically and such, or non-athletically. You can have pain underneath the kneecap. This is the kind where people feel like it's underneath there.
Right, and that's how they get the name patella. Femoral is the femur up here. So the pain is between the patella and the femur, patellofemoral.
And that's another reason why they call it retropatellar. Retro means behind the kneecap. So that's where you're going to have. Quite often you're going to feel it with such things such as going upstairs or going downstairs. Actually, quite often you're going to feel it more going downstairs.
Right, exactly.
And part of that reason, I think, Brad, is because the quad is not kicked in like it should be and pulling it over.
Sure.
And this is just therapy talk.
Right.
But bending, sitting, a lot of times people sit for a long time, and especially if their knees in one place.
Yeah. And then when they stand up,
they really feel they're grinding and they're having a lot of pain.
Sure.
Anything else, Brad, for a sign or symptom?
No, that covers the bulk of it right there as far as the primary symptoms that I hear in the clinic from patients that actually come into my clinic. And
I think one thing, people can really have severe pain from this. This really can sting them. I mean, it really can be sharp pain. Yeah. One thing we're going to be very cautious here is that it's very hard to distinguish between this and a lot of other knee difficulties. We're going to show you a test maybe that you can try, but there's a lot of knee problems that give you problems with standing, going from sit to stand, stairs and such. So don't think just because you're having those issues that it is patellofemoral syndrome. There may be others.
Right. It could be between the joint between the tibia and the femur. It could be a soft tissue issue. Okay,
what we're talking about here is alignment of the knee. And generally what you would like to see is that the kneecap kind of falls in the middle of the leg here.
Right.
All right? What you don't want to see is that if the kneecap is moved over. Okay, I'm moving the kneecap right here. I don't know if you can see that, Nancy, but right here, it's over here now, as opposed to being right here. A lot of times when people actually dislocate their kneecap, it goes this way and it pops out.
Right.
But what we're seeing here quite often with patellofemoral syndrome is that it's just a little bit off. All right, Brad, do you want to show why that's a problem?
So here, if you take the skin off of my knee and we look at what's underneath there and how the anatomy is, we got the quadriceps here, which are the red muscles here, and then actually the patella is part of the tendon of the quadriceps, and that's what this white material is here, this white tissue. And if the tendon goes over the top, and if you flip it up here, you can see a model of the kneecap, and this part of the knee actually rubs against the femur. And here's the femur bone, and it looks like that classical two-bump bone that you see in the cartoons or whatever. And how that rides through those bumps is where the pain can arise from. Okay, so when you see Bob push my kneecap back and forth, we're just doing nothing more than getting this kneecap to shift back and forth from one condyle to the other.
And if you look, there's a smooth trail. This kneecap actually moves up and down as you're doing things. It's not just stable, doesn't just stay there. It actually is moving up and down, and there's a smooth trail for it. I always kind of equate it to, let's say you're driving down the road, and it's a nice smooth road, but also you go off to the side a little bit and you hit those rumble strips.
Sure,
You know,
yeah.
or wake-up strips, I think they call them. That's the same thing here. You're going down a smooth path, but if the kneecap gets too far to the side, it actually can start rubbing on the side there, and that starts wearing off the bottom of the kneecap. It can start wearing it down, and that's what they call the chondromalacia, softening of the cartilage underneath here.
Sure.
So this is where the problem is. So how do we solve this problem if you do have a little bit of an alignment issue? That's what we're going to talk about next. Brad just passed out from the pain. He's having so much pain from this kneecap issue that he's laying down. But I wanted just to show you one test that we do to see whether or not it is kneecap pain. We do a lot of tests, but this is one that is really kind of distinguished from all the others. So what I do is I'm actually going to take my thumb and my hand, and I'm going to put it over the top part of the kneecap. And Brad's supposed to be relaxed. And then what I'm going to have Brad do is actually tighten up slowly, Brad. So he tightens up, and if he starts having pain, and plus he can't hold the contraction, that's a good indicator that it might be some of that kneecap pain, that patellofemoral syndrome. And Brad was able to hold it. Did you have pain with that, Brad, though?
No.
But I bet you if you went fast, you probably would.
Right, and
Yeah.
the great combination, your pressure and me pulling up on there, sometimes they can pinch some tissues in there, even if there is no diagnosis actually in there, but you know, when you go slow like that's controlled, I didn't have a problem with it.
So what are we going to do if we find out that this is the problem? Let's say the kneecap is a little bit over, and it generally is over this way. It's generally going to be more aligned towards the outside of the leg.
We'll call it lateral.
Luckily, what has happened here is there's a rock star therapist in the physical therapy world. We don't have too many heroes, but we have Jenny McConnell.
Right.
And she invented the McConnell taping technique. She's out of Australia. Let's put up her picture. Can you put up her picture? Thanks, Nancy. It's kind of powerful how we can suddenly put a picture up, isn't it? Well, Jenny invented a technique, and we're not going to show you this. I just don't feel comfortable showing how this would be done.
Right.
But what you do is you actually take some tape, and there's a special type of tape you have to use because you have to put down an underlying tape first, and then you put another tape over the top, and it's going to pull the kneecap over so it stays in place. Now there's other things you're going to be able to do to try to help keep that kneecap in place. You're going to do some stretches, and you're also going to do some strengthening. But I have had very good luck with using the tape.
Right.
I mean, I've had people come in with pain. They can't do the steps. They can't get up without having pain. I put the tape on immediately.
Right.
They can, not always, but immediately they can do these things without having pain.
Right, they're smiling.
They're smiling. Just like this kneecap
You're
is.
right
So,
there. This is a kneecap with McConnell tape and done right.
what I would suggest is if you're having that type of pain that we're thinking that you're having, is to go ahead and go out and see a therapist and one that has been trained in the McConnell taping technique.
Sure.
And have them test you, see if that's what it is, and then maybe give it a try.
You bet.
By the way, Brad, I thought it was kind of fun how she could put that picture up there. Let's put up a couple more. How about Eddie Albert?
Go Eddie.
And if you know who that is, I want you to make a comment below. And let's try Fred Gwynn.
See, I didn't know who Fred Wynn was until you told me.
But I bet you might know.
They'll know.
Don't give the obvious picture. Just give a picture without him, without makeup on. All right, and you're also, while you're looking at these pictures, and come back to us now, you're going to want to subscribe to us, Brad, right?
Right down here,
Because-
subscribe. If you're 40 and over and you want to have some help with your health and fitness, we can help.
We are the people, because we have inside baseball knowledge.
And we have fun too.
Right.